The new BYU Medical School could be the next Johns Hopkins. In the 1860s, 70s, 80s, and 90s, the planners and founders of the Johns Hopkins Medical School had a choice. They could either create a school that trained and educated students to excel within the current flawed system, or they could create a medical school that would catalyze and transform the entire medical education system in the country and the entire medical and health system in the country. They chose the former, and that made all the difference. I'm Dr. Chad Swanson. I'm an emergency physician, and this is my 5-minute daily health systems transformation video. I learned 5 lessons in researching and learning about the founding of the Johns Hopkins Medical School. And I think there's important implications today for new medical schools like the one that's being planned at Brigham Young University in Provo, Utah, and others around the country. First, a few disclaimers. Number one is I taught at BYU for a few years in the Department of Health Sciences as an adjunct faculty member, but I have no role whatsoever in the planning of this new medical school. Second caveat or disclaimer is that I'm not a professional historian, though I am writing a book that's set in the time of Johns Hopkins Medical School. So I do have some knowledge about this. And third, I'd like to consider this video an informal conversation or conversation starter. So I'm very happy to clarify or correct. So please send comments or criticism if appropriate. The first takeaway from the Johns Hopkins experience is that there was a powerful shared vision. So from the initial documents from Johns Hopkins, the person that donated a large amount of money to the medical school and to the hospital, to William Welch, who was the first dean and a laboratory scientist, to John Shaw Billings, to Daniel Gilman, the president of the university. There was a vision of something different, a vision of connecting medical education to laboratory science and research, to the hospital, and advancing medical specialties, including nursing. These all seem like ideas that are simple and straightforward, but at the time they were highly controversial. Hospitals were places where patients went to die. Medical specialties were met with suspicion and reluctance. These founding members for the Johns Hopkins Medical School had a vision that was transformative. It was something new, and there is tremendous power in that. If the organizers and founders for the BYU Medical School also have a choice. They can either create a medical school wherein the students will excel within the current system, or they can carefully consider and plan and have a strategy so that students are transformational health leaders in their communities and that the school itself plays a role in that transformation. The second lesson from the Johns Hopkins experience is that the vision can drive the people that are involved and the organizations and institutions. All of the 4 founding doctors at Johns Hopkins, William Welch, Halstead, Osler, and Kelly, were in their 40s or 30s. And William Welch, when he first met and was discussing the idea of this new medical school, was 26 years old. So they were very young. They all had unique and interesting personalities. Halstead was addicted to cocaine and morphine. They had challenges as human beings. But they were chosen because they fit the vision. There were many other people from Harvard to the University of Pennsylvania to the University of Michigan who were much more experienced at the time, but they didn't have the innovative spirit. They didn't have the progressive spirit that these younger doctors had. Similarly, the medical school was tied closely to the hospital, to research institutions. They involved nursing and specialists. So today, does that mean that the faculty and leaders at the BYU Medical School should be younger? Maybe, maybe not. Should they be unconventional? Should they even be considered misfits by some, or rebels even? The founding members of the Johns Hopkins Medical School were in many ways considered those things in their time. They were brilliant. They were very accomplished. They were progressive and innovative. So the vision should drive the people and institutions, not the status quo or convention. Number 3, with a powerful vision and momentum, humans will emerge that can support the vision in ways that are unexpected. I love the story of Mary Elizabeth Garrett. When the medical school was running out of money, she was wealthy. She garnered support from other wealthy people, and she donated a large amount of money so that the medical school could be established, and she insisted that women be accepted to the medical school. So if there are donors today, if there are wealthy people, influential people, well-connected people, or simply determined people who can be helpful in the organizing and planning of the BYU Medical School or any other medical school, then they can get involved and make a significant difference. The fourth lesson that can be learned from the Johns Hopkins Medical School experience is that it can be a huge leverage point for transformational change for the rest of the country. So Johns Hopkins was considered a model for medical education. In 1910, there was a report called the Flexner Report that held up the Johns Hopkins Medical School as a model. And then over time, it took decades, but over time, medical school quality and rigor increased. And the idea that a school should be tied to a hospital, should be tied to research, became the standard. And that changed every community in the United States where there were physicians who were knowledgeable and experienced and had the skills for scientific medicine and surgery. And it changed the status of the United States around the world, the status of its biomedical research. Number 5, the fifth lesson that can be learned from the Johns Hopkins experience. Let me back up. So number 4, for leverage, there are unique opportunities for the BYU Medical School to also develop a novel model that can then be replicated in other places in the United States. There are 2 that I recommend, but I'm sure others will have plenty of ideas. One is that all matriculating medical students at the BYU Medical School be required to major in transformational change in health systems. So all medical students that enter the medical school are well-versed in the challenges, the history, the economics, the equity, the justice, the driving forces behind our health system, our medical system, and what makes us as human beings sick and well. There is too much burnout. There is too much bankruptcy because of medical costs. There's too much suffering. Our metabolic disease burden is unacceptable. And so we are at a point where a new paradigm is needed, and the starting of this medical school could be a powerful leverage point, just as the Johns Hopkins Medical School was in the late 1800s, early 1900s. And then finally, the fifth lesson that we can learn from the Johns Hopkins Medical School experience is that institutional change can have long-lasting outsized effects. So we mentioned the Flexner Report, which the effects were felt in communities around the country, and then the US became a leader in the world. Similarly, BYU's medical school could have a large-sized, outsized effect long-term. I'd love your thoughts and comments. Thank you.